There's a lot of confusing information out there regarding foot pain in general, and in particular plantar fasciitis. One of the most common misconceptions is that people have foot pain because their muscles are too weak. To that statement, I'll simply say this. In the Olympics, there are athletes who run miles at a time around a very big track. These people have some of the strongest feet on the planet. So you may be surprised to learn that they get foot and calf pain. And they suffer from plantar fasciitis too. So foot pain isn't just a matter of weak muscles. Let's take a brief but more in-depth look at some of the common causes of foot pain. Here are the 5 major causes of foot pain that we will explore. If you have foot pain, you suffer from at least one, and probably several of these. One of the most common causes of foot and calf pain are trigger points. To keep things simple, we'll define trigger points as painful, hard areas in muscles. These trigger points are painful to the touch, and they can refer pain to distant areas. As you can see, they're found throughout the body, and they're usually found in predictable areas of the muscles. Trigger points can cause 2 kinds of pain. The first is local pain at the site of the trigger point, and the second is referred pain, that you feel far away from the trigger point. And that's the reason the pain caused by trigger points can be very frustrating for you. For example, there's a long muscle in the leg that starts at the knee and ends at the foot. When this muscle is involved, it causes pain in the big toe. The X's are the trigger points in this muscle that cause your pain. The red areas are where you feel the pain. But notice that the X's are nowhere near the red areas, where you're actually feeling the pain. If we treat only the areas shown in red, we won't be treating the cause of your pain, and you probably won't get better. We need to treat the X's found in the muscle to get rid of your red areas of pain. It's just that simple. Because the body has so many trigger points that refer pain to distant areas, it's easy to see why trigger points are often overlooked by the patient as a source of their pain. Stretches sometimes help to calm trigger points. However, stretches can also aggravate trigger points and increase your pain. Trigger points make muscles shorter, and this creates 2 problems. Short muscles with trigger points pull harder on the joints than normal muscles. This stops the joint from moving smoothly, and this causes pain and stiffness. As a chiropractor, short muscles are important because correcting trigger points lengthens the muscle. This normalizes the tension on the joint, and this allows the chiropractic adjustment to hold longer. The word that health professionals use to describe scars is fibrosis. As you can see, scar tissue, or fibrosis, can form in any tissue of the body. Whether the scar is on the surface of the muscle or deep in the muscle, the effect is the same. Scars make muscles shorter. And like trigger points, scars create 2 problems. Short muscles with scars pull harder on joints than normal muscles. This stops the joint from moving smoothly, and as we know, this causes pain and stiffness. For example, if you have scar tissue in the muscles of your feet, your muscles are shorter than they should be. These short muscles pull on the joints in your foot, and this pulling stops the joints from moving smoothly. What you feel when this happens is pain and stiffness when you try to walk. The name commonly given to this condition is plantar fasciitis. Scar tissue has 4 basic causes, and the first is trauma. That's where something hits you or you hit something else. The second is repetitive motion. This is an easy concept to grasp. We walk on our feet all day long, every day. If repetitive motion is a major cause of scar tissue, then it's no wonder we have an abundance of it in our feet and our legs. Third, we form scar tissue as we age. It's just one of those facts of life. Our last cause of foot pain is improper body mechanics. This is where we ask a body part to assume an unnatural position, and usually for long periods of time. Take a few seconds and see if you can think of one of the most glaring examples of improper body mechanics of the foot. woman wears high heels, the muscles of the foot and the calf are greatly shortened for long periods of time. The bottom line is this. Improper body mechanics or poor foot posture causes three things: scar tissue, trigger points, and lastly, extremely poor body mechanics can place a great deal of stress on the joints. This not only causes pain, but over time, this can lead to arthritis of the foot joints. All three of these can cause a great deal of pain, and over time, the pain can become constant. This kind of pain is called plantar fasciitis. Fortunately, relief is usually felt quickly when the scar tissue and trigger points are treated directly. Many bones and muscles work in harmony to make up that magnificent machine we call the foot. When they work as they were designed, we can run fast, we can jump high, and we can dance the night away without pain. But when just one muscle or one bone stops working as it should, it can make our lives miserable. I've known patients with such disabling pain that they had to crawl to the bathroom in the morning. And forget about wearing high heels. Just the simple act of walking can become a daily nightmare. A massage is a wonderful thing. It relaxes the muscles and it feels great. But I find that pain and spasm in the foot will often return quickly unless four things are accomplished. First, the trigger points in the muscles that cause the spasms and pain, well, they need to be treated and calmed. The scars are hard and they make muscles short. I use techniques that gently tug at the scar tissue. This makes the scars and the muscles longer, more elastic, and less painful. Trigger points in scar tissue cause the muscles to shorten, which pulls the joints out of alignment. Therefore, the joints must be gently repositioned to allow them to glide smoothly again, as they were designed to do. Lastly, specific exercises are prescribed as part of your rehab. Weak and wasted muscles must be strengthened so they can carry the load and allow the joints to assume their natural position without pain. Our goal is to get you moving without pain as quickly as possible. Do you suffer from foot pain that seems to be progressing or just won't get better? Is it a painful struggle just getting out of bed in the morning? Have you given up the thought of ever wearing high heels again? Well, perhaps you should consider an approach that combines soft tissue techniques with gentle, pain-free adjustments. This is the approach I take with my patients. Call and set up an appointment for treatment. It'll surprise you just how good it feels to feel good.